What can an echocardiogram reveal about your stroke's cause? Imagine trying to find the hidden clues behind a mysterious event. When it comes to strokes caused by blood clots or other heart issues, an echocardiogram acts like a detective tool that helps uncover those secrets. It's a special ultrasound that looks inside your heart to see what might have caused a stroke. About a quarter of strokes happen because a clot forms in the heart and then travels to the brain, blocking blood flow. An echocardiogram can help identify the source of that clot, making it a vital part of stroke diagnosis. There are two main types of echocardiograms. The first is called a transthoracic echocardiogram, which is a non-invasive test where a probe is placed on your chest to send sound waves into your heart. It shows the size of the chambers, how well the walls move, and if there are any blood clots or valve problems. The second is a transesophageal echocardiogram, which involves inserting a thin probe into your esophagus. This gives a clearer picture of the heart's internal structures and blood vessels, especially useful if the first test doesn't give enough information or if doctors suspect specific issues. Echocardiograms can reveal several heart conditions linked to strokes. For example, they can detect atrial fibrillation, which is an irregular heartbeat that increases the risk of blood clots forming in the heart. While atrial fibrillation is often diagnosed with an electrocardiogram, an echocardiogram can show structural changes in the heart that make this arrhythmia more likely. They can also identify a patent foramen ovale, a small opening between the heart chambers that some people are born with. This opening can sometimes allow clots to bypass the lungs and reach the brain, especially in younger stroke patients. Blood clots in the heart, known as thrombi, are another critical finding, particularly in the left atrium or ventricle, which can break off and cause a stroke. Valve problems, such as vegetations from infections or calcifications, can also serve as sources of emboli. Additionally, the test can show if the heart muscle is weakened or if there are wall motion abnormalities that promote clot formation. The usefulness of an echocardiogram depends on the patient's age and the type of stroke. It is especially helpful in younger patients under 50, where identifying a heart source of embolism can lead to targeted treatments. In older patients, the findings might be less specific, so doctors decide whether to perform the test based on individual circumstances. When a cardiac source is found, it can directly influence treatment plans, like starting blood thinners or anticoagulants to prevent future strokes. Although atrial fibrillation is usually diagnosed with an electrocardiogram, echocardiography helps find other heart issues that might need specific management. In stroke care, transthoracic echocardiography is often used first because it's quick and non-invasive. If more detailed images are needed, especially to look at the heart's internal structures, a transesophageal echocardiogram is performed. This approach helps doctors piece together the puzzle of what caused the stroke and decide on the best way to prevent it from happening again. Remember, every patient is different, and the decision to use echocardiography depends on individual health factors. If you or someone you know has had a stroke, consulting with a healthcare professional is essential to determine if an echocardiogram is appropriate and to interpret its findings accurately.